Salmonella is not something that I think the public should necessarily fear, but it is something they should be aware of. It basically causes food poisoning most of the time. There is a chronic state of Salmonella that some individuals can develop over time, which makes it much more difficult to eradicate, and they can have some chronic symptoms related to it. But most people, it is basically food poisoning where you end up with diarrhea, sometimes with blood in it, fever, abdominal cramps, nausea, vomiting, those kinds of symptoms, which usually occur about 6 to 72 hours after ingesting food that is infected with the Salmonella bacteria. Now, the foods that typically are of most concern regarding Salmonella are things like eggs, which has been in the news recently, but also poultry itself, beef, even water contamination. On occasion, water supply contaminations can be a source of Salmonella poisoning. It's known that if eggs have been pasteurized or fully cooked, then it does kill Salmonella. So the same is true for beef and poultry. If you cook it thoroughly, then you will kill the Salmonella bacteria. Probably the most important thing regarding Salmonella and the diagnosis actually is the history. And that is when a patient comes in and they tell you that they've had some bloody diarrhea, which is one of the key factors, is the presence of blood, because usually viral gastroenteritis, which is what most diarrhea and nausea and vomiting episodes are, they're viral, not bacterial. Most of those do not involve blood in the stools. So if a patient reports blood, then that increases our concern for the potential of some bacteria. And then, of course, the history of exposure to a potential food source, one that was either eggs that were undercooked or poultry or beef that was undercooked, and the time frame with which that person was exposed. So the meal that you ate and then you get sick 20 or 30 minutes later, that is usually not food poisoning. Usually there's a delay of 6 hours to 72 hours after ingestion of the food. But one of the key factors certainly is in the history that somebody has been exposed to one of those things. And in today's environment, with the egg recall that's occurred with the FDA and the tainted eggs with the Salmonella, certainly somebody's exposure to eggs within 6 to 72 hours of getting sick would increase the concern that a doc might have. And at that time, when a patient comes into the clinic at Access Medical, ultimately the doc's going to take a look, listen to the history, do a physical exam, and potentially draw some blood, like a CBC, to look at the white blood cell count in a patient. And maybe, depending upon how long the diarrhea or how severe it is, may actually do some stool studies and send those a sample of that off to check for Salmonella directly.